Hello, my name is Victoria Rodriguez and I'm a consultant psychiatrist. I work with adults to help them overcome difficulties and symptoms associated with a wide range of mental health conditions. I received my medical degree from Cantabria University in Spain, but I came to the UK in 2017 to begin my PhD in Psychosis Studies research at King's College London. During my time in the UK, I've worked as an honorary psychiatrist at SLAM, which has the largest mental health training institution in the UK. I have also worked as a specialty doctor in psychiatry for St Anne's Hospital's crisis team, a community mental health treatment team in Lambeth, and I gained experience at Bedlands Royal Hospital's National Psychosis Unit. I've also worked as a locum doctor at various practices throughout London for Medas Healthcare. My varied positions have given me excellent insight into the public and private healthcare systems in the UK, which I combine with my expertise and training in academic psychiatry to provide my patients with the highest quality of care. I treat a wide range of adult mental health conditions, and due to working in so many different settings, I got to help patients from a variety of different backgrounds. I have experience helping people who are suffering from conditions such as anxiety, depression, bipolar disorder, psychosis, schizophrenia, and obsessive-compulsive disorder, among others. I also often see people whose symptoms don't seem to fall under a specific diagnosis or category, which is far more common than people might think. My approach to mental health is always seeing someone as a whole person rather than just a diagnosis. Mental health conditions often overlap, so I think the most important thing is to understand each patient as a unique individual and develop a personalized treatment plan according to their needs, preferences, and circumstances. As my PhD is in Psychosis Studies research, I have a strong interest and knowledge in the whole spectrum of psychotic disorders, ranging from first episode psychosis to schizophrenia and treatment-resistant schizophrenia. I have also a special interest in understanding and dealing with psychological issues associated with giftedness. I use a range of tools, including psychoeducation, to support people with these difficulties. In our first consultation, I will go through your medical history and ask you to provide detailed information about your current life circumstances. This is so I can understand all the biological, psychological, and social factors that could be contributing to your symptoms or condition. This is called the biopsychosocial model, which takes into account any biological vulnerabilities that could be interacting with psychological factors, as well as the influence of our relationships, which could include our partner, family, work, or friends. By taking a wide range of different factors into consideration, I will be able to come up with the best treatment plan for your specific needs. Your first consultation also needs to be a space where you can fully explain the situation and experiences that made you seek help in the first place. This can sometimes seem like a daunting task, so if you prefer to have 1 or 2 introductory sessions, then this can be arranged. By the end of our first session, we will be able to identify some goals that you would like for your treatment and how I can best support and help you to reach them. I always use an holistic and personalized approach when designing a treatment plan. This includes considering individual symptoms and whether any medication could substantially help to improve symptoms, as well as the latest guidelines and scientific evidence for treating the condition. I also consider your environment and whether there are any factors that could be influencing your symptoms, such as ways to promote a restful sleep or reduce stress, in ways that suit your lifestyle and schedule. When it comes to treatment plans, I believe the best plan will be developed through close collaboration between myself and the patient. In fact, the improvement starts by setting clear and realistic goals together, from which I will work in giving you the right support that you need including adjustment the treatment plan according to your goals. I believe that some mental health symptoms might require or benefit from medication at the right time and at the right dosage for the individual, and I have expertise in the use of psychopharmacology. However, I also believe that going to psychiatrist doesn't necessarily mean you should always take pills. When deciding whether to take medicine, it's important to consider the evidence base for that specific medication, along with the personal preferences and needs for the patient. Treatment plans involving medication will also be personalized, and I use a flexible strategy so the medication can be altered or stopped depending on how you respond to it. I understand that the patient should play an active role in the treatment decision-making process, which includes carefully constructed treatment plans around when to start medication and how to better decrease or discontinue it. After finishing the initial assessment, which could take place over 1 or 2 sessions depending on the complexity and your personal preferences, we will be able to set some general goals for your treatment. I will share my clinical impression and suggest a personalized treatment plan. After beginning your treatment plan, we will work together in adapting that plan while assessing and monitoring closely how you are feeling, as this ensures the best chance for improvement. First, I would tell them that simply watching this video is a very important first step towards finding the right treatment for them. By watching this, you have been able to recognize that either you or someone close to you is going through difficulties that require professional help and support. When it comes to psychiatry, sometimes people can find it difficult to seek help for problems and experiences, even if they are not their fault. For anyone feeling like this, I want to emphasize that going through mental health difficulties is normal. It happens to everyone at some point of their lives, and is far more common than you might think. However, the process of getting help is usually a very positive and life-changing experience for my patients, as it provides an opportunity for them to understand themselves better and to realize where they would like to be. They gain tools that allow them to better cope with whatever difficulties they are facing and can rely on those tools and strategies when they face problems in the future, which ultimately make us a better version of ourselves.